Hello everyone. Welcome back to Nanotech. Today, we will explore the use of nanotechnology in the treatment of ischemic strokes. A stroke is an unexpected and acute brain disorder, typically triggered by either a cerebral blood vessel hemorrhage or occlusion. Insufficient blood flow to the brain can result in dysfunction in brain cells, oxidative stress, and neurological damage. Stroke symptoms, including numbness, confusion, and aphasia, are directly tied to the affected areas in the brain. 87% of strokes are associated with brain ischemia, while the remaining 13% are linked to hemorrhage. Cerebral ischemia sets off a series of harmful processes that ultimately result in the death of neurons. Reperfusion, a clinical approach, aims to restore blood flow in the brain. This can be achieved through the administration of tissue plasminogen activator mechanical thrombectomy, both of which are used for the treatment of ischemic stroke. However, reperfusion frequently results in tissue damage. This is because the sudden influx of oxygen during reperfusion leads to the generation of reactive oxygen species, ROS, which in turn initiate inflammatory responses, including the production of cytokines and the infiltration of leukocytes. Numerous neuroprotectants have been developed to mitigate reperfusion-induced injuries, however, none have received clinical approval. Several factors contribute to this lack of success. Ineffective drug delivery. One major challenge is delivering drugs effectively to the brain due to the presence of the blood-brain barrier. Drug characteristics. Some drugs have short circulation times, poor stability, or toxic properties, making them less suitable for stroke treatment. Complexity of stroke. Some drugs have short circulation times, poor stability, or toxic properties, making them less suitable for stroke treatment. These challenges highlight the ongoing efforts required to develop effective neuroprotective treatments for stroke patients. Molecular pathways in stroke pathology. Acute ischemic stroke followed by reperfusion triggers a sequence of pathophysiological alterations. These include neuronal injury, oxidative stress, localized inflammation, and compromise of the blood-brain barrier integrity. Neuronal injury. Neurons are the primary constituents of the brain and are highly susceptible to the effects of ischemia. When blood supply is reduced in the ischemic brain, it results in a decrease in adenosine triphosphate levels and the development of lactate acidosis, disrupting the ionic balance within neurons. Oxidative stress and its consequences. Oxidative stress plays a significant role in ischemic stroke by promoting the generation of reactive oxygen species. These ROS, in turn, trigger pathways related to apoptosis, necrosis, and autophagy. Oxidative stress also has a detrimental effect on nitric oxide availability within endothelial cells. Nitric oxide is a potent molecule that inhibits platelet aggregation and leukocyte adhesion. The reduction in nitric oxide availability exacerbates coagulation, further worsening the ischemic insult and contributing to reduced blood flow in the brain. Inflammation response. Inflammation response is an important event in ischemic stroke and the subsequent reperfusion. Treating ischemic stroke poses several challenges. Many therapeutics have a short circulation time and struggle to penetrate the blood-brain barrier, limiting their access to ischemic tissues. Additionally, managing drug release and developing innovative drug delivery systems are crucial aspects for enhancing ischemic stroke therapies. Nanotechnology in stroke treatment. Nanotechnology plays a pivotal role in addressing these challenges by enabling the design of nanoscale materials tailored for biomedical applications. Nanoparticles, typically ranging in size from 50 to 200 nanometers, are engineered to encapsulate drugs. This encapsulation not only enhances drug solubility but also facilitates targeted delivery to specific tissues. These nanoparticles are smaller than cells yet larger than small molecules, making them exceptionally effective carriers for delivering therapeutics drugs and precisely controlling their release. This approach holds promise for advancing therapies across a broad spectrum of diseases, including ischemic stroke. Theranostic approaches for ischemic stroke. Theranostic formulations hold considerable promise in the treatment of ischemic stroke as they integrate both diagnostic and therapeutic functionalities. Notably, nanoparticle-based platforms represent innovative solutions, as they enable the incorporation of imaging agents and drugs within a single nanoparticle framework. For example, formulations combining neuroprotectants and Fe2O3 magnetic nanoparticles can simultaneously deliver therapy and facilitate imaging.